Welcome to AI DocuFeed, where we break down complex documents into easy-to-understand podcasts. Today, we're tackling the official Medicare and U 2025 handbook. Be sure to check the show notes for links to FAQs and worksheets you can use to follow along or fill out after the show. Please note, this podcast is for informational purposes only and does not provide financial, medical, or tax advice. Always consult a qualified professional for your specific needs.
Hey everyone, and welcome to this deep dive as we try to, unpack this whole world of Medicare Advantage plans.
Yeah, a lot of folks, especially maybe if you're part of the baby boomer generation, are probably starting to think about this stuff.
Exactly. Medicare can feel really overwhelming, especially when you're first starting to look at it.
Definitely. And there are so many options out there.
So we're going to break it down for you and focus specifically on Medicare Advantage plans. So let's just jump right in. What is a Medicare Advantage plan?
Well, you can think of it as a way to get your Medicare Part A and Part B coverage, the hospital and medical coverage,
Right.
through private insurance companies.
Okay, so instead of going through the government directly.
You're basically choosing a company. You're choosing a plan from a private insurance company to sort of manage those Medicare benefits for you.
Gotcha.
Now, most of these plans also include drug coverage Part D, which is pretty convenient to have everything bundled together.
Yeah, absolutely. That sounds like a good simplifying thing if you're trying to keep track of all that.
Yeah, definitely. But there are some things to keep in mind. Some of the trade-offs to consider when you're thinking about Medicare Advantage, and one of the biggest ones is network restrictions.
Okay, network restrictions. What do you mean by that?
So unlike original Medicare, where you can generally see any doctor who accepts Medicare, Advantage plans usually have a network of providers that you need to stick to, except for emergencies, of course.
So it's kind of like joining a special club.
You could say that.
And they have their own rules, their own benefits, their own doctors you can see.
Yeah, and here's the thing about that these provider networks can change. So doctors can leave the network, and then all of a sudden, you might not be able to see the same, specialist you've been seeing for years.
Right, so let's say I've been seeing an eye doctor for a long time, to get my eyes checked, and then suddenly they're not in my plan's network anymore. What are my options there?
Well, you basically have a couple of options. One, you could pay out of pocket to continue seeing that doctor. That can obviously get pretty expensive. Or you could switch to a different plan during the open enrollment period, which happens every year, from October 15th to December 7th.
Gotcha. So it sounds like choosing a plan with a network that, feels pretty stable and has doctors that you want to see is important.
Yeah, definitely. Especially if you're someone who, you've been seeing the same providers for a while and you like them, you want to make sure that they're going to be in your network.
Right. You don't want to have to switch just because of your insurance.
Right.
Okay, so let's talk about the costs involved with Medicare Advantage, because obviously this is a big factor when people are choosing plans.
Yeah, absolutely. Costs are definitely key consideration, and you'll typically have monthly premiums, just like with other types of insurance. And these premiums can vary quite a bit between different plans. Some plans may have a $0 premium, but even in that case, you still have to pay your Part B premium.
Right. Okay.
So there's no such thing as completely free.
Gotcha. So even if the plan premium is $0, you're still paying something for the Part B.
Exactly.
Okay.
Then you have deductibles, which is the amount you pay before the plan really starts to cover things.
Okay, so you got to hit that deductible first.
You got to hit that deductible first. And on top of that, you've got co-payments and co-insurance.
That's starting to sound like a lot.
And co-payments and co-insurance, that's what you pay each time you see a doctor or you get a service.
Okay, so every time I go to the doctor, I might have to pay a co-payment or a percentage
That's right.
of the bill as co-insurance. Wow. So you've got premiums, you've got deductibles, you've got co-payments, you've got co-insurance. It's a lot to juggle.
It is a lot to juggle, and it's really important to understand those costs before you sign up for a plan.
So are there any strategies that people can use to kind of, be smart about the costs and maybe save a little bit of money?
One thing is to really carefully compare plan benefits, because some plans offer extra perks that original Medicare doesn't cover. Things like dental, vision, or hearing.
Oh, that's interesting. Okay, so if you're someone like me and you need to, get your eyes checked regularly or you need new glasses,
Right.
that might be a really valuable benefit.
Exactly. And those kinds of benefits can really save you money in the long run. You need to weigh the value of those benefits against the plan's overall cost. So it might be worth paying, a slightly higher premium for a plan that covers those services if it means you're saving money in the long run.
Right, so it's like finding that right balance.
Exactly, finding that sweet spot between coverage and cost.
And speaking of cost, what about these out-of-pocket maximums? I've heard about those. Like, is there a limit to how much you could spend?
Yeah, that's a good question. And Medicare Advantage plans do have a yearly cap on how much you'll pay out of pocket. But there's a little catch there. It only applies to in-network care for covered services. So if you go out of network or you need a service that's not covered by the plan, those costs can add up pretty quickly.
Oh, so it's like a safety net, but it has some holes in it?
Kind of, yeah. You got to be careful with that.
Okay, this whole Medicare Advantage thing is starting to sound like a real puzzle. How can people, like, make sure that they're choosing the right plan for their needs with all of these different, costs and benefits and networks and all of this stuff?
That's a great question, and it's something we'll definitely dig into a little bit more. But first, let's talk about the different types of Medicare Advantage plans that are available.
Okay, all right. I think I'm ready for the next piece of the puzzle.
If you've made it this far, chances are you're finding this helpful. Why not share the clarity? Subscribe to the podcast and share it with someone who might need a little Medicare guidance. Let's help more people navigate this together.
All right, so we're back. And we just finished talking about, the basics of Medicare Advantage and some of the things you should consider, like network restrictions and costs.
Yeah, those are definitely some biggies.
But now let's get into the different types of Medicare Advantage plans, because I know there's not just one.
Right, you've got options, and it's good to know what's out there.
Yeah, like what kind of plans should people be aware of?
Well, you can almost think of it like, choosing a car. You got different models, right? Each with their own features and their own price tag. It's kind of the same with Medicare Advantage. You've got HMOs, you've got PPOs, and then a few other types of plans.
Okay, so HMOs and PPOs, those are terms I've heard before.
Let's break those down. So first we got HMOs, which stands for Health Maintenance Organization.
Health Maintenance Organization, okay.
And HMOs typically have lower premiums.
Okay, so that's good.
But they have a tighter network of doctors and hospitals that you can use. And you'll also usually need referrals from your primary care physician to see specialists.
So if you're somebody who likes to just go see whatever specialist they want, whatever they want, that might not be the right plan.
Yeah, an HMO might not be the best fit for you in that case.
Okay.
But if you're looking for lower costs and you're comfortable with, a more limited network, it could be a good option.
Okay, so HMO, lower costs, but less flexibility.
You got it. All right, what about PPOs?
So PPO stands for Preferred Provider Organization.
Okay.
And they give you more freedom to see doctors outside of the network.
Okay, so more flexibility there.
Exactly. But you'll usually pay more for that flexibility, so you might have a higher deductible, and your out-of-pocket costs could be higher.
Okay, so trade-offs there.
Always trade-offs.
Gotcha. Higher costs, but more freedom.
That's the gist of it.
All right, so we've got HMOs, PPOs. Are there other types that we should mention?
Yeah, there are a few others. So we got special needs plans, or SNPs.
SNPs.
And these are designed for people with specific health conditions like diabetes or heart disease.
Okay.
They offer coordinated care and benefits that are tailored to those needs.
Oh, so it's kind of like a more specialized plan. For people who have, some unique healthcare needs, then you've got private fee-for-service plans.
PFFS. This is a lot of acronyms.
I know, right? And PFFS plans, they don't always have a network. So you have a lot more freedom to choose your doctors, but you need to make sure that the provider actually accepts the plan's payment terms.
So there's a little bit more legwork.
Yeah, a little more responsibility on your end.
Okay, got it.
And then lastly, we've got medical savings account plans, or MSAs. And these combine a high deductible health plan with a savings account. So the plan puts money into your account each year, and then you can use that money to pay for qualified medical expenses.
Interesting. So that might be good for somebody who's, really good at managing their own money and their own healthcare spending.
Yeah, if you're comfortable with a high deductible and you want more control over your healthcare spending, an MSA might be a good fit.
But it also means that, you're on the hook for more of those costs up front until you hit that deductible.
Yeah.
Okay. All right. So we've got HMOs, PPOs, SNPs, PFFS, and MSAs. It's like alphabet soup over here.
It is a mouthful, right?
So how do people sift through all of that and figure out what type of plan is actually right for them?
That's where things get even more interesting, because it really comes down to understanding your own needs, your priorities, and of course your budget.
So what questions should people be asking themselves?
Well, that's something we're going to dig into in the final part of our deep dive.
Okay, I'm ready for it. Bring on the questions.
Let's face it, Medicare can be overwhelming. From figuring out parts A, B, C, and D to understanding enrollment periods, it's a lot to take in. But don't worry, we've got you covered. Check out the show summary for a downloadable FAQ sheet and a worksheet designed to help you navigate Medicare step by step. These resources are perfect for following along with today's episode or diving deeper into the details later.
Okay, so we're back for the final part of our deep dive into Medicare Advantage.
That's right. We've talked about what these plans are, the different types out there, and how to keep up with all those changes.
Exactly. So now what? We picked a plan we think is a good fit, but then what, how do we make sure we're getting the most out of it?
Yeah, that's a great question, and it's something a lot of people don't think about. You choose the plan and then you kind of forget about it. But it's important to stay engaged throughout the year.
Right. And I think just practically speaking, staying organized can be a challenge with all the paperwork and the bills and...
Absolutely. Organization is key, especially with Medicare. You got all these different documents you got to keep track of.
Like we talked about, those important ones, the annual notice of change and the evidence of coverage.
Right. Those are essential. But then you also have, bills and receipts and any correspondence with your plan.
So do you have any tips for wrangling all that information?
Yeah, definitely one simple tip is to just create a dedicated folder or binder for all your Medicare-related paperwork.
Keep it all in one place.
Exactly. And, if you're more tech-savvy, you can also go digital. A lot of Medicare Advantage plans have online portals or apps where you can access your plan information, track claims, even message your provider.
So you don't have to deal with all the paper.
It can be a lot easier to manage things online.
And I imagine it's also important to reach out to your plan's customer service if you have any questions or you're just feeling lost.
Oh, absolutely. Don't hesitate to call them. They're there to help you. They want you to understand your benefits and how to use them. And then I guess the other big piece is making sure you're actually using those benefits that you're paying for. Because if you don't use them, you're basically just leaving money on the table.
Exactly. So schedule those annual checkups, get your teeth cleaned, update your eyeglasses, whatever services your plan covers, take advantage of them.
So it's all about being proactive.
Exactly. Don't wait until something's wrong. Stay on top of your health and use those preventative care benefits. Okay, so we've talked about staying organized, reaching out for help, maximizing benefits. Is there anything else that you would recommend to people as they're kind of going through this whole Medicare Advantage journey?
I think the most important thing to remember is that your healthcare needs can change over time. What works for you today might not work for you next year or the year after.
It's not like a one-and-done decision.
You got to stay engaged. You got to reevaluate your options every year during open enrollment.
Make sure it's still the right fit.
Right, because life is dynamic and so are our healthcare needs.
I think that's a great note to end on, and I want to thank you for joining us today and sharing all of your expertise on Medicare Advantage. I think we covered a lot of really important information, and hopefully our listeners are feeling more confident and informed about their choices. To our listeners, thank you for tuning in. We hope you found it helpful, and remember, you're not alone in this journey. There are resources available to help you every step of the way. So stay curious, stay informed, and stay engaged in your healthcare.
Thanks for listening to AI DocuFeed. Please help our show by subscribing, leaving a review, and sharing with others. See you next time.